Hi everyone, it's been a while. So this week we're discussing policies related to healthcare disparities. We've been instructed to visit the Kaiser Family Foundation database, which is a repository for a broad swath of social and cultural and economic information related to healthcare. This compendium of information serves as an excellent jumping off point for many areas of thought. Continuing the theme of discussing disparities that affect the vulnerable populations of West Virginia, I've selected an article published just a few days ago, in fact. The article, by Drew Altman, touches on the continuing struggle of the uninsured and how contemporary political, economic, and legislative trends have and are shaping the current day's tribulations. The article's not nearly all doom and gloom per se, though it is heavily. It does do well to focus on the major accomplishments made with regard to reducing the number of uninsured Americans. In fact, as of the 2022 census, only 25 million Americans were uninsured. I say only like that's a small number. It is not. That number, though, is half of the 50 million that were uninsured at the peak just a few years ago. Still, though, there is a lot of information that is obfuscated within that presentation of data. So the number of Americans that live below the poverty line is 35 million currently. That number is, unsurprisingly, relatively near the amount of uninsured. The number of uninsured Americans is also double the amount of children living below the poverty line, which is, I guess, good in a sense. This line of reasoning is, of course, omitting a very important and potentially much larger group of individuals who are the underinsured. That is those people that technically do have coverage but can't afford the coverage or the bills that come with it, or both. But that's a discussion for another time. So anyway, the uninsured is a very broad category. However, this was one category in which, thankfully, West Virginians actually score slightly above or slightly below, depending on your point of view, the national average. West Virginia comes in a bit below the national average for uninsured at only 7% of our total population not having insurance. The good news does stop there, though, unfortunately. We are decently below the national average in employer-sponsored healthcare utilization and well above the national average in both CHIP and Medicaid usage, according to the West Virginia Department of Health and Human Resources. One huge problem that's faced by many of the uninsured, that's likely only to increase in severity with the incredibly recent winding down of the COVID protections for federal funding requirements, is simply a lack of knowledge. Often being able to actually ascertain what programs one qualifies for and then where and how to apply for them is one of the biggest hurdles that a person faces when they're attempting to get assistance. There is currently a stopgap proposal that the current administration is pushing that is attempting to give some coverage during this period of transition where certain groups and individuals are being pushed from maybe one type of coverage to another or being forced to find their own coverage in total. But it's important to note that in West Virginia alone, from April 23 to March of 24, over 520,000 people applied for Medicaid. Of those people, only about 280,000 were accepted. So that leaves another 200-some thousand that were either put back under review now or were just flat out denied and were either pushed to other avenues or are just forced to find their own assistance, period, if they can at all. The next few years do, for these reasons and others, stand to be interesting and potentially very tragic from a healthcare access standpoint. So I believe on that bleak point that covers everything. So thanks for listening and have a good rest of your evening, folks. Thank you.